Hi, so I work for a company that works in a lot of the local hospitals in the Kansas City area. We go in and speak with patients that are uninsured, and the whole idea why we do this is to help them try to find some type of health insurance, whether it be towards government insurance, or we have our own private insurance company that works out underneath of us that has really low, reasonable rates. So if it's something that they can't afford through like the healthcare.gov website, which is the marketplace that Obamacare launched through, or Blue Cross Blue Shield, or Aetna Coventry, which is some of the major health insurances that are in the Kansas City area, they can go through our company, but the only thing is they have to be a patient of ours. So it's kind of like a pro-con situation. Mentioning the Obamacare stuff, Missouri actually opted out of Obamacare, so that means that a lot of people think that with Obamacare it's something that they actually have the opportunity with. Obamacare is the negative outlook in Missouri, I should say. Since we opted out of it, a lot of people think that, oh look, I get cheap health insurance. No, our health insurance is the exact same cost as what it was a year ago. They might have raised the prices a little bit just because everything changes year in, year out. Prices may go up, prices may go down, depending on what's going on with the economy. Since Missouri opted out of it, the open enrollment November to March really didn't affect us any. Just because they said that you have to be enrolled during those dates, it really didn't make a difference. You could have went to Blue Cross Blue Shield's website and enrolled today, or you could have enrolled 5 months ago through the same thing and got the same plan. It really didn't make a difference. If you went online through the marketplace, the healthcare.gov website, it would have showed you the exact same plans through everything that the Kansas City place had to offer, regardless of going through the healthcare.gov website regardless. So a lot of people don't understand that in the state of Missouri. So whenever I go into the patient's room, you go to start mentioning the Obamacare stuff, whether or not they did the open enrollment, had the opportunity to go online and read all of this stuff and explain everything to them. They're like, oh, okay. The only bad thing to all of this is when it comes to doing your taxes at the end of the year. If you do not have health insurance, whether it be through the marketplace, healthcare.gov website, Blue Cross, Aetna, Coventry, Medicaid, Medicare, they're going to tax you. They're going to tax you depending on how much money you make. Me being my neighbor being my neighbor, you making $100,000 a year, you only making $12,000 a year. It all depends on how much money you make, how old you are, your gender, and what insurance technically that you should have, and what's affordable to you. A lot of people also don't understand that. They think, oh, it's going to be one flat price. No, it's really not. It might be $1,200 for one person. It might only be $600 for another person. It's all depending on how much money you make and what kind of health insurance you should have. Another thing with the Obamacare that Missouri also opted out of, Medicaid. Medicaid also did not change for the state of Missouri. Neither did Medicare. The Medicare actually went up in their rates for their Part B. Medicaid, nothing really changed. The application changed a little bit. Other than that, nothing changed. I mean, you still have to meet their standards in order to get Medicaid. A lot of people think that I don't have a job. Oh, I can apply. No, unfortunately, it doesn't work that way. Medicaid nationwide is almost the same criteria. You have to be either disabled, you have to have children without a job in order to get Medicaid. And it's really frustrating that people think that just because they don't qualify for the Obamacare, that they can apply for Medicaid. It's a very strong and frustrating situation for the hospitals, because they think that most of their patients that come in there are going to get, health insurance one way or another, but they don't. They come in and they give out a fake social, they give out a fake birthday, just so that they don't have to pay their bill. And a lot of people don't understand that a lot of hospitals have financial applications, and most of their bill will end up getting written off anyways. If they take the time to have people come in and, like me, who know this kind of stuff and explain to them, most of everything will be taken care of. Give people the opportunity to come in and speak with you, who will educate you on everything that you need to know when it comes to health insurance, when it comes to getting your health taken care of. I mean, it's just some quick couple questions. Ask questions back. If you're not familiar with things, ask the questions that you want to know. It's a very easy situation. I'm in and out of the patient's room within 5 minutes unless someone has, quite a bit of questions when it comes to understanding Obamacare. Obamacare is one of the easiest yet hardest things to understand because it puts you in one of the hardest situations. Do I really need health insurance if I really don't go to the doctor that much? Yes, you do, because you never know what could happen to you. You could break your arm, which in the long run will end up costing you $15,000. You could get sick, which will end up costing you a couple $1,000s. You never know what's going to end up happening to you. But the only bad thing is with Missouri, since we opted out of Obamacare, you still need health insurance, and a lot of people don't understand that. There's several pamphlets out there that you can read, and free health clinics have them. All the hospitals have them. The hospitals have their version of what Obamacare is, but it doesn't sit there and say, oh, don't go through Obamacare because it's worthless kind of situation. But again, almost every state's different. I don't know what each state has in store for themselves, but I just know exactly what Missouri is, and Missouri has pretty much their own thing set in stone. So that's it. I mean, we have everything going forward for us, which, I mean, everything else looks good on our own healthcare kind of stuff. But I mean, health insurance is important for everybody, and health insurance is something that we all need. I mean, don't wait until the last minute to go to the doctor, people. It's something good.